Awesome. Hello, everybody. I hope you're able to see and hear us okay. For the format of this webinar and recording, we have turned off mics and cameras just so that way we can make sure with bandwidth that we're able to prioritize presenters. But we do have a chat and a Q&A. You should see them at the top of your screen. So at any time, you can submit questions, you can chat. In fact, if anybody would like to go ahead and in the chat, just shout out your title, your name, your organization, a fun fact. We would love to hear from you. We want to try to keep this as interactive as possible. I also am going to be requesting for my co-presenters on there, from now forward, if you see anybody else that is waiting in the waiting room, go ahead and admit them in. I'll try to do them as I see them pop in too. So we have quite a fun presentation for you all today. We're going to keep it really informal. I will start with an introduction of myself, and then I will have each of the presenters also introduce themselves as well. So we have essentially a facilitated discussion today to focus on a lot of our solutions that we've been working throughout the years. We'll talk about our history, kind of with what's led us to where we are today, some highlights of some of our latest tools and offerings that we've put together, focusing on the outcomes and processes that we've done in our own hospital. That's kind of the beautiful thing that we've done here is everything that I'm going to show you and talk about are outcomes that we have seen and experienced at Regional One Health, which is really exciting. So a little bit of background about me and Regional One Health, and then we'll go ahead and keep it going. So my name is Janny, and my previous role at Regional One Health was serving as a director for the Center for Information and Analytics. It was basically our internal department and analytics hub for the hospital. Regional One Health is a very old hospital. It's actually the oldest in Tennessee. It's 200 years old. We are a level 1 trauma center, a safety net hospital. We're on a journey to become an academic medical center, always increasing our service lines, recently adding on oncology. And so, you know, we are always battling this, facing our past history and how old we are with how much we also love and lean into innovation. So you're going to hear a lot about that story today of how, even though, you know, we may have a little, we are so creative with what we do have, and we still lean into innovation. And it's a really, really cool part of our story. So with that context, you know, we were essentially being asked with making this organization data-driven, make people excited about data, make people trust data, make people have a relationship to where they're asking questions about data and engaging with data. And how do you do all of that when your data is all over the place? You're dealing with some systems that may not be so sophisticated. You're also dealing with still some systems or people or departments that are still documenting either by hand, or maybe there's not even a sophisticated documentation in place. Or you're also, as the years go by, you're starting to get more of these more technological solutions. And so how do you navigate this landscape of a big range of technology, and then people who are also in a different range of experience of dealing with technology? So that was how we entered into our adventure with analytics and innovation. We started off pretty small as a department, and we started off with some very simple use cases to try to prove some early wins. And one of them was actually with our emergency department, which I'll have Dr. Lord kind of, as we get to his part, you know, talk about some of those early ventures and excitement we had around data. We also, you know, knowing that we had a big opportunity around our length of stay and inpatient care and throughput, we wanted to reduce that length of stay. And by doing that, we needed to see that data more in real time and not a month late after financial numbers closed. So what happens when you start seeing that data more quickly and you're starting to get that data in the hands of the right people at the right time to have better conversations? And then we also had some quick wins around our pharmacy. We had a lot of opportunity around encouraging folks to fill their prescriptions at our own Regional One Health pharmacies. And through these early initiatives, we started seeing a lot of not only just financial return on investment, but improvements in our actual patient care, which at the end of the day, that's why we're all in this job. We want to improve patient care. So we started seeing these early outcomes. We started expanding our analytics and dashboards and technology solutions throughout the hospital towards now we're at the point where Brittany Byers, who is actually on the call today, she is our new director for our Center for Analytics. I've now moved into a role where instead of serving the internal hospital, I'm now serving an external capacity where we take everything that we've done in our own hospital and have tested and have seen the outcomes and make it available for others and support others in their technology and analytics adoption. And we've now partnered with technology solutions to be a healthcare expert. And so with all that introduction, I will now open it up to our team to just do some round robin introductions, and then we'll dive into our first question, which is essentially around innovation and how we got started. So speaking of round robin, I'll have you introduce yourself first, and then we'll go to Dr. Lord, Angel, and then Allie, I'll have you actually introduce yourself when I ask the first question. So Robin, you can take it off.
Absolutely. Good afternoon, everyone. I am Robin Clanton. I am the Director of Managed Care for Regional One Health and UTROP.
Hi, everybody. I'm Keto Lord. I'm emergency medicine by training. I'm a recovering medical director of the emergency department. I have since moved on to do more revenue cycle, physician advisor work, and I'm here because we had some pretty good successes recently. So, yeah.
Good afternoon, everyone. I'm Angel Parker Hefner. Currently, I am the Vice President of Operations. My background is in nursing. Did come to Regional One Health to establish the first oncology inpatient program here. So super excited and proud of that, and really, really, really passionate about patient experience, which led me to partner with Allie and Janie on our PX engine.
Awesome. All right, Allie, we'll ask the question first, and then you can go into your introduction because it's obviously really related to this part of the story. So you lead the Center for Innovation. You also wear many hats around Regional One Health, but can you tell us a little bit about the Center for Innovation, how it plays a role in this story? Also really zeroing in on what was that big gap that we were trying to solve when this vision for a Center for Innovation popped up at Regional One?
Yes, thank you so much, and welcome everybody. We are super excited to have you here. We love that you're making time for this opportunity because we really have an excellent story to tell, and our teams deserve for us to tell the story, and so we're super happy that you're here to listen. So as Danny mentioned, I have the pleasure of leading the innovation team as the Chief Innovation Officer. I came to Regional One Health in 2018, so going on 8 years here. I'm really excited about that. Innovation was something that leadership back in 2017, so a year before I arrived, decided it was something that was worth investing in as a way for us to remain resilient and relevant to our community, which is not something that you commonly hear, but it is some in terms of healthcare, right? We always see healthcare as a need, right? We're needed, but really we're also a business. Healthcare is a business. Healthcare has customers. Healthcare has customer experiences, and so it's really important that from the standpoint of running a successful business, we also think about resilience and relevancy as part of our strategic agenda. So in 2017, leadership decided to commit to that for Regional One Health. And so how do we do that? What does innovation look like? So it was decided that innovation, and there's a lot of definitions out there in the marketplace for how you define innovation, but for us, it was really about empowering innovators through unique programs that were specifically designed to inspire, because that's a lot of what we're going to talk about today as well, build, right, and amplify, because there's a lot of work that is already taking place internally and externally around innovation, and so it was important for us to recognize that and to take the time to amplify those efforts. We work with both internal innovators and external innovators, so a lot of innovation happens when you're in the trenches, right? When you're kind of going through it day by day. But there's a lot of innovation that happens outside of that lived experience where someone is just asking a question. And so again, that was very important for us to recognize and to be able to put programming around. So we work with both internal and external innovators in different capacities. And we encourage problem-focused solutions. And we use different frameworks and methodologies like customer discovery and value proposition design to help influence a lot of those efforts. What does that mean, right? It means being able to really understand the pain points, the jobs to be done, the opportunities, and understanding their intensity and their frequency, but more importantly, who is affected by that. And you can actually say that that's how the Innovation Center was created. We looked at understanding our customers. We looked at understanding the jobs to be done, which was deliver healthcare, but we need to do it in a way that's relevant and in a way that makes us resilient to the external environments. So we use a lot of what we our frameworks, all the approach that we execute on a daily basis to create the innovation department. And again, we carry that through the day-to-day. Conversely, we also look at opportunities for new solutions that have been validated in-house using ourselves as the customer profile, right? Because again, we are our own customer in terms of being able to deliver solutions and services to our patients. And so we use a lot of those opportunities that have been validated to assess whether they're desirable, whether they're feasible, whether they're viable solutions that we can then take to the marketplace. And so in terms of the gaps, as Danny, you mentioned, we saw an opportunity for us to demonstrate how there's so many micro innovations occurring within Regional One Health. We have a almost 200-year-old history. We're the oldest business in the state of Tennessee, and we're the oldest hospital in Memphis. So there's a lot, right, that's happened and evolved over the years. And so the gap was, how can we surface that? How can we bring that to the table and let everyone know how we are innovative? Every single day we're innovating so that our patients can have better tomorrows. And so, yeah, that's essentially the evolution in our story and the importance and the value of innovation. And one of the reasons why part of the work that Jenny is doing today exists today, because we recognized what was happening internally, and we felt that it was important for external audiences to also recognize and have an opportunity to share in some of those successes. Jenny?
Awesome. Thanks, Allie. And I think we have a little bit of more time to stay on you if that's okay. But you have a lot of I don't know what else to call them other than like mindsets or frameworks that you have to lead your work. I know one of my favorites that I have borrowed from you from the day I met you, which is fail forward. And I do that every day of my job of just trying something until it works. And I feel like that's one of the best ways to lead into innovation. But are there any other frameworks or mindsets that you feel like are really important to how we lead our work here at Regional One, or what sets us apart from others?
Sure. I would say I talked a little bit about customer discovery. The value of customer discovery is that you're taking the time to really understand and become an expert at the problem so that when you're drafting a solution, that solution has a greater chance at success. So interviews, feedback is huge. One of the things that we do a lot here is, hey, let's try something and get some feedback. Let's pilot it. Let's stress test it right off the bat. And so that's one. Agile is another one, right? Being able to focus on what's minimally viable first and create a minimally viable product that we can then pilot and test and get feedback. So those two things I think have been extremely fundamental in how we see solutions. You can also talk about lean. Lean is part of that conversation as you create value proposition designs. That's another methodology as well, or more of an approach of how you organize the work and come up with solutions. And then lastly, the one that you mentioned, I think, well, there's two elements to that. One is think about the art of the possible. A lot of times we focus on this is the problem, we have so many problems, and we need to turn that into a how might we question so that it changes our frame of thought. And now we have an opportunity to ideate a solution. So what is the art of the possible in the current situation that we're in? How might we create this value while also solving for this problem. And then lastly, we need to understand that you can't fall in love with the first solution. The first solution will always fail, and you've got to fail forward.
I like that. And Dr. Lord, I'm going to go to you next because I think that's kind of a fun segue. But you are definitely someone, since I met you, you are an expert in the problem, the solution, and I feel like you are always thinking of the art of the possible. You're always like, what if we do this? This doesn't seem right. What if we do this? There has to be a better way. And I really love that about your personality. You obviously have navigated a lot of this around the emergency department, OBS. I was wondering if you could just tell us a little bit about that story and that journey of how did you see these problems? How did you bring people together? And, over the years, kind of where do you feel like we're at now? / what do we still have to improve?
I think the first thing you have to figure out where you are from a cultural perspective, right? And we had really good people in the emergency department that care passionately about our patients, but there was a cultural issue with understanding that the best place for patients isn't in the waiting room. It's the most dangerous place in the entire hospital, right? And so convincing people of that was difficult. So I think one of the things we had to do was change the culture, but you do that by providing information, right? So information by itself doesn't change culture, but you really do need it for everybody to buy into it. So the first thing we did was understand why we had patients leaving at 14%, right? 14% of patients that came to the emergency department were leaving either against medical advice or leaving without being seen. And so that's not a sign of good quality care. And I said, I'm not an average doctor here. You guys aren't average nurses. You guys aren't average people. Why is our left without being seen and our AMA rate so high? And there was a lot of this and that. So the first thing we had to do was map out the entire process. And when I say map out, I'm not just talking about what's easy to measure, but what's also difficult to measure, right? One of the things we do at healthcare is like, this is easy to measure. And so we end up kind of overemphasizing its value in terms of the process. In reality, there were little nuanced things that were taking up a lot of time. So our door to registration, our door to bed, how long it took for a patient to get transported to a CT scan, these little pieces added up. So what we ended up doing is we ended up mapping out each part of the processes, and then we were able to figure out where the pain points were. And what we thought was going on wasn't really going on. I think when you leave for the day, what goes on behind the scenes sometimes isn't what you think it is. And so we realized that the process that we had on paper didn't match what was going on, right? And I think that was the first thing. And so we had about 18 steps to see a doctor, right? And we wanted to reduce that to as little as possible. So we got rid of all the duplicate processes. We mapped it out. And then we were able to bring in key stakeholders. I think one of the things that we often do is that we, in management will sit around and high five each other and talk about the data. But in reality, you got to get the troops on the front lines and get their input, right? If they're not bought into it, nothing changes. I promise you, the charge nurse that's been there for 30 years is not going to listen to some MBA come in and tell them what to do, right? They need to understand about how this impacts the patient, their care and their care team, and they're protective of it. And so what we were able to do was align our goals of high quality care, but also use data to show that we could be doing better. And so getting them in the meetings, being responsible for key parts of the processes, we got buy-in. And we identified issues because one of the common things that you always hear from physicians, nurses, is that the data isn't correct. All right, well, what's not correct about it, and how could we fix it? How could we use the data in order to make measurable change? So the data isn't good for this, but it's good for that, right? And so understanding the limitations of the data that we were actually recording was very, very important, because at some point, this is the best we could do with some of the information that we were getting, and the data was flawed, but it was actually very, very accurate in what we needed it to do. So once we got that information together, we were able to sit down, understand, and agree upon what the numbers meant. Then we could actually be able to measure kind of the processes that we're trying to impact. So one of the things we wanted to do was reduce our door-to-doc time. And so not only did we have the data, it was validated, now we could send out scorecards for not just the doctors. So I think everybody focuses on the doctors and nurses, but for our transportation people, for people who are on the front lines doing registration. Everybody had a responsibility, and we all worked together for that common goal of improving patient care through reducing those patients who were being left without being seen. So, I do have, one thing to show you guys here. I will show this because I don't know. Can you guys see this right here?
Yes.
This is my favorite graph in the entire world, right? So you can see here, after our clinical redesign here, we had about 14% of our patients leaving AMA or left without being seen, meaning they weren't getting any treatment. And slowly we were able to show progress, right? Getting down below that national average of 2%. And so this is a marked improvement. And one of the things that I think that sometimes people hear data and stats and statistics, people are oftentimes use it for negative things, but there's so much good work that we do that we don't measure. And I think that this allowed us to actually celebrate the people who are performing at high levels, right? So we changed from a culture of, you look at your numbers yesterday, they were horrible, to let's celebrate all these amazing wins that you were having. And so that really changed the culture of, we can't do any better, to we expect each other to do better. And then we also knew about when those processes weren't working or were broken and length of stay or left without being seen went high. Because we had the entire process mapped out, we were easily able to say, oh, this is a triage problem. Oh, we were short-staffed with nurses. Oh, we had an issue with respect to our doctors, and provide a intervention, right? Because sometimes the numbers may look bad, but parts of your team performed really well. Does that kind of make sense? Like your nurses could have done a great job and done everything they possibly could have done, but we were short a doctor, right? And being able to have that information turned what could have been a bad day to a, wow, you guys really worked your butts off, right? And so by doing these things and changing the culture and also being competitive with other hospitals, right? That's also something that we needed to do too, because we wanted to be the best. We were able to really get out there and see our patients. So our door-to-doc time decreased by 50%, right? We were one of the fastest hospitals in the entire city. And that really was very helpful for our pride here at Regional One, because it really aligned with our culture. Our culture is we want to do the best thing for our patients. We care passionately about them, but we were able to show that our processes reflect that now too. So if you come to Regional One and you come into the emergency department, you're going to get screened, you're going to get seen right away. I mean, that's what we do here. And then we'll determine what that next best step is to. But it took a while for us to get there. It took a lot of work on the front end. But I think that and I probably talk about AI at some point, but I think it's really important. I can't harp on this enough. You got to have good data. It has to be validated, and you have to understand the limitations of your data. If you let some AI learn on bad data, you will have a lot of problems and a lot of bad assumptions going forward. And so by taking the time now to map out your processes on the back end, it'll be very beneficial for you in the long term, because then when you end up using AI to train it, you'll have good data and no limitations of it, right? And so I think that's also an important factor of that. But yeah, we made some great progress. I'm really excited. I mean, a lot of the stuff that we were working on still is there today. And I think that's where you do that huge cultural shift, but you need to have data there that you're able to customize and be able to send people on an ongoing basis to make it easy for them to manage their staff members.
Thank you so much. And yeah, I'll definitely ask everyone's opinion here about kind of what you see the future of AI at Regional One Health, and even just broadly, like in your roles, what you're familiar with healthcare. So we'll definitely end today with asking some of those questions, because I think a lot of folks on here are probably like-minded in that you're curious about it, but you're also maybe a little nervous too, because healthcare is kind of an interesting sector for AI to play in, because of the sensitivity of the data that we're dealing with. So another problem solver, and Dr. Lord, I'll come back to you actually to talk more about this topic that I'm going to talk about with Robin, because I know you experience similar problems, but from that person who's been on the provider side, and also with your role now. But Robin, you're also another person that lives in the problem-solving world. You're obviously, well, I'll have you kind of describe what you focus on in your role, but we kind of got connected because of the work that I'm doing with our data visualization platform partner right now, which is Domo. and we implement a lot of our solutions on their platform. And we got connected because we realized that there was a huge opportunity with a lot of what we were seeing around our denials, our claims, DRG downgrades, like everything related to that. And in fact, there's a lot of different software that we use at Regional One Health, some that have even been, from my understanding, purchased just in the last couple years to help close this gap. And it seems that there was still a gap. And so we got connected to basically say, hey, Janie and team, is there something that we can do to leverage this platform to build something for us? And the answer is yes. So Robin, can you talk a little bit about what is this initial, problem that you're experiencing? What are some of those pain points, and how are we working on a solution? Obviously, the theme today is for collaboration. So tell us that story.
Absolutely. Well, as you mentioned, Dr. Lord and I, there's so many different systems, and we're working with insurance companies to try and get patients approved. And then on the back end, we're trying to get paid for the services we provided. And there are a million different systems. And then each team within the revenue cycle has multiple reports and work queues and everything. So what we found, and one of the biggest pain points, is that sometimes, managed care may be working something from a payment variance perspective. Meanwhile, the business office is calling, sitting on the phone, talking to a payer, asking them why they paid wrong. And then HIM could be looking at it from their perspective as well. So working with Janie and her team, she was able to combine all of that because it's all one patient, right? So she took the reports from multiple systems and combined it at the patient level, so we can now see and identify trends. And when you're looking at a payment variance, we can tell, hey, we didn't collect the dollars that we were contractually supposed to on this account. But why? Did we calculate it wrong? Was it a DRG downgrade? Did we get denied? Was it a post-payment take back? Where's our money? And what's the root cause of doing this? But by Janie's team being able to take those multiple reports, we figured out a way to tag them. So payment variance is now the all other. But using the different reports, they were able to say, hey, this is the DRG we billed, but this is the DRG we got paid. So now, instead of chasing DRG downgrade letters, we're able to proactively, work those with the payers, because if you don't respond timely, then the payer just says, hey, we were right. You didn't respond timely, so sorry. Some payers it's 30 days, some payers it's 90 days, but now we're able to identify trends and work things proactively instead of reactively.
That's perfect. And I know, you're giving me a lot of credit, but I want to also throw that credit back to you. We wouldn't have been able to pull the right reports or design the tables that you need if you weren't part of that design process. So can you talk a little bit about, I can leave the room, but how has that process been of working with analysts to describe, what your need is? How do you translate your need in a way that an analytical team is able to comprehend that and build something for you? How has that process been? And then Dr. Laura, I'll actually come back and talk to you about this too, because I know you have also a whole other perspective around, what this problem is like from a clinical perspective too.
Well, the team has been amazing to work with, and this is a relatively new tool that we've been working on for probably 6 weeks, and we're already identifying like huge opportunities. And but we've fallen forward a few times.
Yeah.
So initially the thought was to have like all of the population and everything we did, all claims basically. And as we've worked through this, we've narrowed that down. we don't want to look at everything. You know, we want to look at this time period and this situation. And so that's one way that yeah, it's just been a wonderful collaboration as we just meet and brainstorm. What does this mean, and how do we tag this? And
yeah,
so we've
and I
learned a lot
know
together.
we really have. I saw some emails coming through today, and if you feel comfortable talking about it, but can you talk about just some of the very, very early improvements that you've seen, or outcomes or opportunities you've noticed just during this testing phase, and then what you're hoping, you know, by the time we have this fully launched in January, what your kind of vision is of the full opportunity?
Absolutely. So, you know, one thing I've noticed, I'm going to date myself because I've been doing this a long time, but before the Cerners and Epics of the world, you know, we literally would print off our payment variances by payer. So you could kind of see trends at a large scale. You know, do we need a new radiology fee schedule? Because for 15, you know, pages I've looked at, there was a variance of $23.53 on this code. So you could see the big picture, you could see the trends. But after Cerner and Epic came into play, you have all these work lists, and the teams are looking at one account at a time. So what we've been able to do using the RevIQ tool is look at the big picture, like, hey, I got underpaid 473 times on an ER level 4 for this payer. And you know, we've sent those off to be researched. You know, are there any emergent diagnosis on this? And another one was our you know, another payer was paying us a normal newborn on our NICUs. But you can see, you know, hey, this just isn't happening on one account, it's happening on multiple accounts, and you know, it's a big opportunity.
Well, thanks. We've really enjoyed working with you as well. So I'm excited to continue to see this tool grow. Speaking of which, you mentioned obviously we're kind of in an early phase right now where we've pulled the data. We've kind of created these tables to help you prioritize or help identify some early trends. I know we've talked about that. We're going to start bringing in AI and workflows over just the next couple weeks to automate some tasks and to help you all with your work process. Can you talk a little bit about what your vision is, or what, you know, from your perspective, where you think the big opportunity is for AI, and essentially, you know, what our homework is for you for the next 2 weeks?
Well, our vision is that, you know, I don't know how many of you have ever looked at follow-up notes on a single account, but there are pages. You know, there are pages and pages of those, but there are certain words in those pages of notes that we're hoping to use AI to tag, you know, appeal. And then, you know, hey, this one's been appealed, and, you know, we need to track and see if we got, you know, a successful recovery on this account after this date. You know, medical record requests. Those are just tag words that you see over and over in those pages of notes. And rather than scrolling down, if the tool can read the notes and just pull out the pertinent information, not, you know, called and no answer. We don't need that note.
Well, awesome. Thank you so much, Robin. And Dr. Lord, I did want to make sure that I gave you a chance to speak on this topic, if you'd like, just because I know from your perspective of being a provider, this is probably something that you navigate a lot, and also just your role being, you know, in the physician advisory services. But what is kind of your perspective of navigating this, and what are also some other ideas that you have of how AI and automation can play a role in this, and we can add your tasks onto our to-do list over the next couple of weeks and have a fully working tool ready for you all.
Yeah, it sounds like a deal. So I'm the physician advisor for the hospital. I do all the peer-to-peers for medical assessment for the inpatient stays, so every single one. And it's increased dramatically. And I think what you're seeing is you're seeing AI being used on the payer side a lot more frequently. And then also just testing to see if you respond, right? I think there are a lot of deadlines. And I think for hospitals who are large and have, hundreds and hundreds of people doing things, it's a very different story for smaller hospitals like ourselves that, we're lean. And so we need to make sure that we get credit for all the hard work that we do. I think that what I'm excited about is that historically, healthcare's always been siloed. Okay, it's always been siloed, and I think that what we're seeing with platforms like like Domo and these tools is that we're slowly taking down these walls and creating more transparency. A couple of things that I think are really notable is number one is I was talking to one of our IT guys. He said, "Man, we have like 150 platforms and none of them talk to each other. And they all have data that's meaningful, right? From the pager systems to, your EHR, which everybody knows about, to the PACS radiology system, transportation, revenue cycle has another 20 or 30. They don't talk to each other. And I think that that makes it difficult for us to work as a team sometimes. And that's where I think that these platforms and having a central hub is helpful. The second point I make is that a lot of times when we roll out these platforms, when we start off, everybody gives us a high five, they take our money and then they leave. But, the information that you need on day one is not what you need 3 years later, right? Your organization grows for different questions, right? They're different requirements. And so a lot of our platforms are, historically have been stuck in go live from 10 years ago. And I think that, where these platforms play a role is being able to manipulate and customize the data for the issues that we have today. And so the issues of today may not be the issues tomorrow, but they're issues of today. And having that information at our fingertips will be helpful. And I think also just, letting you understand that, like, why it's a big issue. I think our doctors really care passionately about our hospital and want us to get credit for the work that we're doing. If it means changing one thing or another, they're happy to do so, but they got to know what to change, right? And so I think where Rodman's team comes in is figuring out, here are the issues we're having with the documentation. Here are the trends. This is what needs to happen. This payer is stating that we're not documenting there, and helping to bridge that gap. So that way we're not just playing catch up. We're actually doing preventative, instructions and interventions as opposed to, chasing our tail. And so I think that's the future. I think AI will be able to make it very easy for us to find trends with payers that we need to sit down with them. It's hard when you deal with so many ones and zeros and numbers and patients, but I think AI will be able to make it very easy that this particular payer has this issue with this particular reimbursement, and we need to have a conversation, or we need to change our what we're doing, or we're dropping the ball in somewhere in the process chain. And so I think I'm super excited about where we're going to go. But I think the first step is what we're doing now, is building it and understanding it and making sure brick by brick that we actually agree with the data and know how to use it and know its limitations and what it works well with and what it doesn't. So, I'm excited for what's going to happen in the near future. Hopefully we have another efficient advisor to help me out here, and it'll be more fun. But I think, just breaking down the silos and being able to, have these systems communicate is essential for us to move forward in the future.
Well, thank you for that, and thank you for the invitation for me to put some calendar meetings on your schedule.
Anytime.
Yeah, but I hope you all are also kind of seeing a window into the level of work that we do to put behind these tools. Like what Dr. Lord's saying, the testing, really understanding the data, seeing how all of these pieces work together in order to truly meet a need. It's not just kind of saying, hey, here's just some tables that we've put together, good luck. Like, we are so engaged in the process. And so I just want you to leave today, hearing these examples of how much we are really putting in time to design things that truly work. And like Dr. Lord said, they need to work on day one. They also need to work 3 years from now. Obviously, we want to make sure that we're building things that are helping us long term. And so that's just the level of care that we're putting into building things. Ali, are you trying to?
Yeah, I was going to add to that. I think one of the beautiful things that, I feel like a proud mom here, but because it's amazing to see how we've internalized as an organization across different layers, across clinical and non-clinical, the idea of focusing on creating solutions that are solving a problem that has high intensity, high frequency, but also understanding who is affected by it the most, and then taking an iterative approach of building, testing, and learning to create and adapt and modify these solutions, and how we are our first customer, right? That we are truly from the healthcare standpoint, we are the experts, but we're also really taking the approach of making sure that we've thought through all of the notions and all of the pains and gains and jobs to be done of our own customer profile in order to influence how these solutions are designed. And lastly, how we're focusing on what must be true in order for the solution to really have the effect and the scalability that we want it to have. So I think both of y'all's examples are a great testament to that, and how we really care, like you said, Janny, and that's where a lot of the innovations are coming from.
Yeah. And this tool that specifically we're talking about, I think Robin mentioned the name, but we are calling it RevIQ. And we are, in that testing building phase. Every day we're adding more and more features, but just for full transparency, our official go live date is in mid-January. But as you heard Robin say, just by testing, she's already starting to see some outcomes and opportunities come in. So by January, this will be fully in the hands of everyone that it needs to be. And so it will actually then be available to other healthcare customers shortly after that. So you all are seeing a very early window, and we'll continue to keep everyone that's signed up for this webinar updated on our real life outcomes. So you can see our own ROI. And again, all of this will be available to you through the tool, and also just our consulting services as well, if you just need our expertise. So speaking of expertise and problems and collaboration and all the themes, Angel is also another amazing colleague that we've been working so closely with at Regional One Health. Angel has also a cool perspective to where she is both an administrator and also a nurse. So also a very cool leader that we have at Regional One. So Angel, we've been working together on what we're calling the PX engine. So I really like Dr. Lord said this phrase of problems of today, but you also, I feel like, have been dealing with problems of yesteryear. So can you talk a little bit about, what the journey of patient experience has been like at Regional One Health? And then similar to what I was asking Robin, what's been the creation process been like? What were those pain points and gaps you were still experiencing? And what was the solution that we all built together and that's currently live in our power units?
Yes, absolutely. So, to Dr. Lord's point, when he mentioned where are we culturally, and I want to say when you look at patient experience, especially when I look at the oncology unit, Route 6, we knew where we were culturally, but the focus was more so on where did we want to be. And so with that, we did have sustainable success with patient experience, which are HCAHPS scores, but the challenge was we were not able to copy and paste, those tactics and innovations. We were not able to do that throughout the hospital. And so it was very challenging prior to PX Engine, because we were collecting all the data, going through the data. As surveys came in, and with Press Ganey, a patient has 6 weeks from the day of discharge to take the survey. And so trying to figure out trends and where were our opportunities on some of our power units. And our power units are the top 5 units in the organization that receive the majority of our surveys. And so just trying to find the trends or the opportunities and come up with initiatives to tackle those, it was a very lengthy process. I would say it could take us anywhere up to 3 months to identify, what the issue is from the time that patient was discharged. And so by the time that we say, okay, so the noise level after 9 o'clock is an issue, by the time we put in or implement something to address that, we have 3 other issues that probably could be occurring. And so with PX Engine, I was so thankful when Janie approached me to be a part of designing the PX Engine. And I will say partially, I think it was because of my background in nursing, but more so because of my compassion for a positive patient experience, because I truly believe it takes all of us. It's not just nursing, it's not just the physicians, not EVS, food nutrition service, it takes everyone. And so with that, with us sitting down and looking at what were some of our barriers or what were our needs, the biggest thing was data collection. Because yes, we were getting the information from Press Ganey, but it was taking so much time to go through it and to identify. And so with that, we even tried to do like a workaround where we went through Qualtrics to develop like a kind of almost real-time QR code where we could get more readily available feedback as opposed to the time that it was taking Press Ganey to give us the feedback. And so with that, Janie's like, I got a solution. We can put all this together. We can use and develop this AI tool where we can use and get real-time feedback from Press Ganey and from the Qualtrics surveys, develop action plans and everything that are unit specific based off the patient's feedback. And so with that, we tried it on 5C first, which is a medical surgical unit, because they again are our power unit. And so one of the first opportunities that we found was responsiveness to call lights. How quickly were we getting it? At the time, before we tried PX Engine on their unit, we were in like the third percentile ranking out of 100 for timeliness of responsiveness to call lights. And so we used that initiative for PX Engine. That was our first action plan. Within that month of trial, we went from the third percentile to the 98th percentile, just alone on responsiveness. And so with that, what came from that, the unit was able to launch kind of like a campaign, which was a no pass zone. And so with the no pass zone, what that meant was everybody from anybody that's on that unit, once that call light goes off, you respond to that call light, and even if you do not have the skill set or the credentials to address what the patient is calling out for, you find someone that can. You find someone, you touch base with the patient, they're able to get a human experience, personal experience in real time while we work out what their needs are. And so from there, we have been able to send or spread the no pass zone to a couple of our power units. When I first presented on PX Engine and our huge, our big organization-wide manager meeting that we have at UT, I had different people coming up to me. They're like, Angel, when do we get PX Engine? I'm like, not yet. It's coming. We were still in the trial phases, but just in that first 30-day trial phase, we were able to see significant benefit, in the timeliness. And so since then, we have been able to roll it out to 2 other power units. We have our 4B, which is medical surgical, and our 5D, that is medical surgical as well. I'm sorry, 5B and 5D is in Delta. We rolled those out like last week, this week. And so now they're working on their action plans. And so right now, I will honestly say, I have not had any issue or barrier since, the rollout of PX Engine. The biggest thing is just getting it to all of the units, because I do feel like all of our units can benefit from it, because it really does take that raw data from Press Ganey and helps us to develop action plans. And some action plans, they are very simple things that we can do today, and some of them are lengthy. It can be a project, it can be strategic, but it's unit specific and it's truly based off the patient experience on each of those units. And so I'm super excited. I love patient experience, I love care, and this engine, this tool has just been amazing for our organization. And I do believe in every time that we do like an education session, as the new units are getting ready to be introduced to it or go live with it or get into testing, I just really let the compassion lead me to say, you guys, this is like what we've been waiting for. On my nursing side, I can remember a time that we wanted a machine that counted respirations for us, right? That's what we wanted, because everybody was like 18. That was just like your default. You default to 18, because if you get sidetracked, Dr. Lord is laughing because I'm telling the truth from a clinical side. And so the best thing that I could say from a patient experience standpoint that I have experienced in my 17 years of nursing is PX Engine.
Aw, that warms my heart.
I know, that was so great. Thank you so much for that.
I know, that was like, I just want to remember that soundbite forever. But yeah, I mean, you said a couple of things too, where I was like, oh yeah, that was part of our journey, and I didn't even remember. You mentioned Qualtrics. And I want to mention this to people because I think it'll give a window into our development. So when I first kind of came up with this framework and this idea, I was so focused just on the Press Ganey kind of official HCAHPS and CGCAHPS data. And that's the original thing that I had really only storyboarded and mapped out that piece of the data. And I think this is what speaks volumes to, you have to bring your end users into that creation process and into that testing process, because it wasn't until I came to Angel and her team and kind of said, hey, this is kind of what I've been thinking about. And they were like, this is all great, but also what about the survey results when they're still in the bed? And I was like, what? I didn't even know this was a thing. So that was because of them that we were like, oh yes, like let us completely add that in. Let's make that all into one data source. Let's make sure that we are bringing visibility into that, and that's being included as part of any of the measurable data that's used for AI. So that was something that would have been left out if we hadn't engaged with Angel and her team from day one. And I think the other thing that you mentioned, Angel, is everyone's excitement. And Ali, I think I borrowed your phrase every time I meet with people, because I want them to know that they are not getting, or at least in the development phase, that they were not getting a completed project. Because the last thing I wanted to do was create something and then hand it to the nurses and go, there you go, because I know that that's usually what happens to them. So I was very, very cognizant and was really intentional about saying, this is a draft, but I want you to test it. I want you to go in there and break it. I want you to tell me everything that is working and everything that is not working, that's wrong, that makes you angry. Like, I wanted everything, because it's that honesty from them that's actually going to help us really, truly co-create something to where it'll actually be used. Because I think that's probably something everyone else has experienced in this organization, maybe at your own, where sometimes you get a solution and then you just kind of stop using it because there's so many gaps that people are like, well, it doesn't really solve the problem anyway, so I'm not going to use it. And guess what? You're still paying for it.
That's true, Janie. I was telling, we were in a session, Montana and I was in a session for PX Engine last week, and I kind of gave the disclaimer. I was like, this was created, with a nurse, with a nurse, with the nurse manager and the frontline nurse mind. Like, that was my state of mind. Like, how could this be very, very beneficial to the leadership? Because leadership, the nurse managers and directors, they are the ones driving the tool. And just knowing all of the responsibilities that we have, I was like, how can we make it easier? How can we make it a one-stop shop where you have the data there? We can see the data not only for that unit, you can see the data and the scores for the entire hospital just on one, in that one dashboard. You can see the action plans. And when we were presenting it to the manager of 5B as in boy, she saw the data from 5C. And she was like, oh, wait a minute. She was like, oh, they already have an action plan for the noise level. And she was like, great, we don't have to recreate the wheel. We can try what he's already doing to see if it works on our unit. And that was just in our first kind of or second introductory meeting with them, just talking to them about what would be the next steps. And from that meeting, she already had an action plan that had already been implemented on a previous unit that she could try. So it's an amazing tool.
That's awesome. I'm so glad to hear that. And so we're at about 6 minutes left. And I think what I'll do here is I'll just go around to everyone again and just ask for just any final closing thoughts. It can be anything, something that you're energized by, something you're looking forward to. To give you all time to think, I'll go first, since I'm just kind of throwing this at you. But I think the first thing I would like to say is just thank you all for being on this call today. I'm also kind of like Ali, where I'm having a very proud mom moment, because obviously me being more on the analytical side, I'm not a healthcare provider. I'm not, someone that's on the front lines, but to truly live that role of help the people who help the people, I feel like that's what I'm able to do at Regional One. So thank you all for leaning into the innovation and leading into the unknown adventure to helping us create these amazing tools. And for folks on the call, like I did mention, Regional One Health Solutions is the external, company of Regional One Health, but everything that we build, that we provide, the consulting, our solutions, our education, our training, all of that is rooted in our real life experience at our hospital, which hopefully you saw a little window of that today. The two tools specifically that we highlighted today are RevIQ, which will be available in mid-January, and the PX Engine, which is actually already available now. Both of those are built on the platform Domo, which is our current partner with some of our technology that we're implementing. So if you are interested in learning more, feel free to reach out to me. you'll get this recording and a bunch of follow-up afterwards with a video of the PX engine, some demo screenshots of the RevIQ. So you'll have all that information that you can reference. But I hope that you leave today energized and inspired for your own organization. So hopefully that stalled and gave my team time to think of their closing thoughts. But Allie, I'll start with you.
I want to echo everything you just said. This is a really amazing, and the what I would like to tell everybody is that there is room for innovation regardless of who you are, what you look like, what infrastructure you have in place. At the end of the day, if you focus it on the customer and really understanding the pain points that drive some of the needs, then you're going to have great successes. To our team, continue to do what you're doing. We have so many projects and micro innovations happening every single day. This is just the beginning of a series, hopefully, of different webinars and content that we're going to be releasing to showcase how innovative Regional One Health is and how we're trying to build the hospital of the future. If you are an external innovator, this is my a PSA, just as a side note. If you're an external innovator, if you're innovating and you're innovating in the healthcare space and you're interested in working with Regional One Health, do reach out. We're always looking for opportunities from an incubation standpoint to co-development to partnerships. Again, we try to work in all different capacities. As long as we're innovating and we're helping move that needle forward, that is our game. Thank you so much for participating.
Thank you, Allie. Robin, I'll go to you.
Yeah, I just echo everyone's energy and Dr. Lord, mentioning, the payers using AI more and more to challenge us. So appreciate all the innovative ideas, that we've, come up with to try and fight back for, so we can get paid for the services we provide. Thank you all.
Thanks, Robin. Dr. Lord, I'll go to you.
I think a common theme here is customization of reporting and data for the people who need to use it. I think historically we've, C-suite and I was to the desk and said, this looks like some great information. In reality, though, who needs that information are the people on the front lines. And a lot of times they don't have the tools they need. And I think that the customizable reports are very helpful in that, so that they can feel proud about the work that they're doing, right? Because a lot of us want to do the right thing, we just don't know what to do. And so having these reports are very helpful. So strong work to everybody. And then I think, before we start to teach AI about, hospitals and how hospitals work, we have to understand how our hospital works ourselves, right? A lot of times we want to skip steps. And I think that is going to be very treacherous for a lot of people, because it's like, giving a license to a 6-year-old that doesn't understand how to drive, right? You really have to make sure you're mapping out your systems, make sure that you understand what the data means before you start adding things like AI. So whatever you need to do in order to get there, you make sure that you do the hard work first before you start adding these agents there. That's about it.
Thank you, Dr. Lord. Angel, anything final from you?
Yes, I would say we are all the patient experience because it definitely takes everyone. It definitely takes everyone. And prior to my involvement with PX Engine, I probably didn't even think about how AI could help us, just with that real-time feedback. And so just super appreciative for the opportunity to help drive this initiative. I do feel like that as we get it rolled out, everybody, like I said, everybody's already asking for it. And so once they get a taste of it, it is just going to take off. And so, but AI is everywhere, whether we are ready for it or not, it's everywhere. And so the best thing I feel like is just to join it hand in hand, and let's walk this journey together. To Dr. Lord's point, learning more about, how AI helps us with the data, understanding our data. It's only room for us to grow and to keep learning. And so these platforms with these two initiatives that we have going on are just a start. It's just a start because AI is everywhere, and it definitely will continue to help us with capturing, our revenue and with our patient experience. So thank you.
Awesome. Thank you, everyone. Thanks for those of you who joined live. If you are rewatching the video, thank you for that. And if you're watching it for the first time, thank you. So I appreciate everyone who signed up, and you will receive my contact information if you'd like to learn more about RevIQ, PX Engine, Regional One Health Solutions, our partnership with Domo, or how we can help you on your data journey. Please do not hesitate to contact me. Thanks, everyone, and happy holidays.